Hello, magandang gabi sa inyong lahat. Ako po si Nurse Ken and I'm going to teach you how to perform infant care. So, mahalaga po ang skill na ito in cases of emergency, such as na-choke ang infant or you found them restless or unresponsive and unawake. So, ano nga ba ang una nating gagawin? First things first is you have to help yourself first. Definitely, you cannot help others if you can't help yourself. Two, you have to know the basic principle of the first aid or the emergency medical services. So first thing, you have to remember this, the CAB. C-A-B. C stands for the circulation and compression. A stands for the airway and B stands for its breathing. So first, you have to check the responsiveness of the baby. So babies or infants don't talk. So how are we going to check if they are responsive? Simply merely by tickling the sole of the infant. Normally po ang infant kapag tinitikil or kinikiliti po yung sole ng kanilang feet, they would move. So that is an indication na responsive sila. However, if there is no response, there is no movement, that would mean they are unconscious or unresponsive. Okay. Second, you have to place the infant on a flat, firm surface. Okay, because you're going to perform your compression, and it's very difficult for you to perform compression if they are not on a flat surface like this one. Next is you're going to check for circulation. So checking the circulation is you're going to check the pulse of the baby. Okay, we call this one as our radial pulse. So with the use of your 2 fingers, 2 or 3 fingers, without using your thumb. Do not use your thumb because it has its own pulse. So check the radial pulse of the infant. If there are beats, if there is none, meaning there's a poor circulation, or there's no circulation noted. Afterwards is you have to do your compression. Now, it is very important for you to know this. If you are a certified BLS trained personnel, then you can go for the appropriate compression, and that is 30:2. Again, that's 30 compression and 2 rescue breathing. However, if you are not confident with your basic life support training, then you can do 100 compression per minute until the help arrives. So how are you going to do that? For demonstration, you have to search for the middle of the nipple line. So here, you're going to compress it here with the use of your 2 fingers. Okay, so on a flat firm surface, use your 2 fingers and compress 100 compression per minute until help arrives. So it is very important for us to know the depth of compression. That is just half to an inch of depth of compression. Do not compress it deeply, as it can result to a rib fracture. Okay, so if the infant or the kid is big enough, so you can position it this way, then you can do compression. Okay, so that's it. Now, what are the signs? Afterwards, you can check for the airway. Again, if you are a BLS trained, you can go for 30 compression and 2 rescue breathing. So you can initiate your rescue breathing through the nose and through the mouth. However, if you are not confident enough with your BLS training, then you can just go for the 100 compression per minute until the help arrives. Okay, so you go on like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Then, 2 rescue breathing. Okay, check for the airway. Okay, and check for the breathing or the rise and fall of the abdomen or the diaphragm of the babies, because most likely the infants are diaphragmatic breathers. Okay, now when to stop CPR? Kailan pa tayo titigil ng CPR? First, if the baby is responsive, definitely you have to stop. Second, You have to stop if the help that you have called has arrived. So after checking the responsiveness of the baby, you have to call someone for help, like calling an ambulance, calling 911, or calling the emergency medical team. That is when you're going to stop. Next, if the doctor declared the patient is dead or not responsive, definitely you have to stop reviving. And lastly, if you are exhausted, so it is very important as a safety precautionary measure for health workers or even first aiders to not to compromise their health. So if you are exhausted, you have exhausted all means to revive the patient. However, the client or the patient is still not responsive to your CPR, then you can stop. Now, once the baby is responsive or has been revived, then you have to position it to a recovery position by doing this. So, once again, I hope you enjoyed this session and see you on the next. Bye.